Hi everybody, I'm Emily. I am the Problem Gambling Program Administrator for the Department for Behavioral Health, Developmental, and Intellectual Disabilities. I also wear a second hat, which is mental health promotion. So I kind of like to tie those two things together, that yes, while we're talking about problem gambling, a lot of these things are also going toward being more mentally well on the whole. So I do kind of both, and I think they fit together really well. So what I'm going to do today is just give you an overview of the Problem Gambling Assistance Program at the state, some of the projects we're working on, and then just a little quick overview. There was a resource kit that was available on the table, and I'm just going to run you through what's in that, how to use those, and then how to stay in touch. All right, so this is just kind of an overview of the program. So why this matters now, we're seeing problem gambling showing up in a lot of our spaces. So, you know, we've heard from a lot of people the last couple days about some of the conversations that are going on with clients and peers and in the recovery communities. And so we know that problem gambling exists for our state. And so what we really want to do is be proactive about creating a strong statewide system that includes prevention, treatment, and recovery. And what makes that possible is leveraging the existing resources, systems, and partnerships that we already have in the state to do some of these other related behavioral health things. So we're not going to create a whole new system for problem gambling. We want to integrate it into what we already have for mental health and substance use disorder. And we're going to do that, how we do that at the state is by contracting with those partners. So we don't have services directly. We partner with other people to provide those services, so that hopefully we can have an impact and really help people to not only prevent but recover from problem gambling. And so it's kind of the same thing. So what we're really looking at is problem gambling impacting individuals, families, and communities in Kentucky. It often goes unrecognized in behavioral health settings, and mostly because a lot of places aren't screening for this yet. We ask a lot of questions on intake, but gambling questions aren't always included in that. And so we want to make sure we're starting to implement screening and referral practices that are more consistent. And then also, as Ronselyn mentioned, you know, we're really trying to build how many counselors we have that are certified. So they did a training, was it October? In October, and they had, you said 4 have already completed, and then we have a few more that are in the process of completing supervision and taking tests so that we can really start to get our existing workforce to be able to treat some of these problems. And then we also want to make sure that we're reducing stigma and making sure that people feel comfortable asking for help. So we don't want to do, I think, what we've done sometimes in mental health and substance use, which is put the responsibility on the person experiencing the problem. It's not a problem with them. It's something that we can help them with, and it doesn't have any negative impact on who they are as a person. So the bottom line here, we want to create a coordinated statewide response that helps us with that screening, treatment, referral, prevention, and stigma reduction. And so the way that we're doing this, we really want to, again, work on workforce knowledge and skills. We want to work on early identification and referral. We need public awareness of how to gamble safely. We know that people are going to engage in this, so before they even begin gambling, we want them having in their head, this is something that could become risky. How do I take steps to protect myself? And then, of course, we want to offer recovery supports for those who have already been impacted. And what makes this possible is our partnerships. And so, of course, the funding through the Problem Gambling Assistance Program is useful. our behavioral health workforce and the expertise they already have, our community-based organizations, our community mental health centers and regional prevention centers, our substance use disorder recovery networks, some of these things that we already have in existence, just adding problem gambling into them. And so we're not starting from scratch, we're building. And so the Problem Gambling Assistance Fund was created to kind of educate the public on these things. So safe gambling practices, what are the risks and risk factors of developing a gambling problem? What are the warning signs? And what are the resources available to reduce the consequences? And here's kind of the timeline of how this account and program was set up. And so the governor signed the legislation in March of 2023. Sports betting went live that September. And then we took a little bit of time to kind of see what the landscape was like after sports wagering began. So a lot of late 2023, early 2024 was really looking at what do our helpline calls look like? What are we hearing from our mental health providers as far as what are they seeing? And that kind of information. And based on that, we released our first notice of funding opportunity in October of 2024. And what we decided to really focus on was public awareness and workforce development. So again, we need people to know what gambling is, what problem gambling is, where they can go for help. And when we send people for help, we need to make sure that our workforce is able to provide the highest quality care possible. And so the first round of projects will actually be completed this summer. I think most of those contracts end June 30th, and then we'll spend the late summer, early fall really evaluating the impact of those, and that will help guide our new funding opportunities. So tentative plan right now is to release some new opportunities this fall. So keep an eye out for those, and I'll give you some information about how to apply for that funding and that kind of thing a little bit later. First, I just kind of wanted to give you an overview of what the funding stream kind of looks like. So again, this is really for the first couple of years here. We just did revenue by quarter. So the total amount is just over $2 million. And so that is the funding that we've had to work with to fund some of these projects. And then the strategy that we're implementing with this money, again, workforce development, system integration, so doing that standardized screening practice, making sure our referral and linkage systems are set up, and making sure we're collaborating. There's a lot of good work that's done. We don't want to repeat it, but we want to make sure that everything's connected. Prevention and public awareness, and then recovery expansion. And just a little overview of some of the projects. So in the workforce development piece, the purpose of this is to expand certified problem gambling providers and strengthen clinical capacity. So again, we're using an international board certification. And so all of our training that we fund is aligned with what that board requires for certification. But we also want to focus on some of the other behavioral health professionals, not just counselors. So that's going to include peer support, community health workers, prevention workers, case managers in some cases. So we want to make sure that we're including everyone in that work, and not just counselors are important, but the other support staff are important too. And so key partners in that, again, have been the Council on Problem Gambling. They put on this conference, and they also do some training, and they do a lot of other good work as well around workforce and awareness. Louisville Recovery Community Connection and Voices of Hope Lexington have both been instrumental in getting some of the peer support pieces off the ground. Project Ricochet has been working with their barbershop and beauty salon initiative. And then we have a couple of other groups, Omni Institute and Education Development Center, that have helped other states set up their problem gambling programs, and so we're really leaning on them for their expertise and what they've learned in other states so we can bring that here and really grow this program to something that works for Kentuckians. The next piece, again, public awareness. So this is really focused on local, regional, and some statewide campaigns to increase the awareness of warning signs of problem gambling, risk and protective factors, connection to mental health and addiction, and suicide included in that as well. That's not on the slide, probably should have been. Sorry about that. Helpline and available resources. And we have a lot of partners on this one too. So we really try to hit things across the state. So we have Four Rivers Regional Prevention Center doing some awareness, North Key doing some awareness, Adonta, Kentucky High School Athletic Association. If anybody went to any, which we've been here, but any of the Final Four or the Sweet 16 for the high school basketball, that's been at Rupp Arena this week. We have all sorts of problem gambling like advertisements and Love the Game Responsibly banners and things at those games. So they've been really instrumental with that. Again, Louisville Recovery Community Connection, Project Ricochet, Shawnee Youth Transformation Coalition out in Louisville has been doing some youth-based awareness to bring attention to that connection between gaming and gambling for youth. Voices of Hope and Omni Institute. And I also want to draw some attention to some of the innovative community-based models that we're using. So in addition to some of those awareness pieces, we have some really unique projects going on that I'm really excited about. So I already mentioned Kentucky High School Athletic Association. Project Ricochet, if you saw their presentation yesterday, has done a lot more than what is on the slide, but you can see this box is itty bitty. So I tried to pick some of the highlight reel for them. So their art-based community engagement. You see some of the art out here that has come out of the project that they're doing. And that's really interactive and it's getting the community involved. And then again, with the barbershops and beauty salons, really pulling in those trusted community advocates. And then again, we have the youth piece with the Shawnee Youth Transformation in Louisville. And the next piece is the recovery expansion. So multimedia campaigns targeting the high-risk populations. We know that there is a high comorbidity between addiction problems and problem gambling. So we want to make sure that people who are already in recovery understand the risks that they're at for developing problem gambling. And so we're embedding these awareness campaigns into the existing recovery events. Key partners here again are Louisville Recovery Community Connection, Voices of Hope in Lexington, and Adonta, working on some of these things. And so what are we hoping will change? So more immediately, we're hoping that our workforce will have increased knowledge and skills. We'll see an increase in screening rates, and we'll see an increase in referrals to treatment. In the communities, we're hoping that we'll see an increased awareness of safe gambling practices, a reduction of stigma for needing help with problem gambling, and an increase in help seeking. So we want people to be calling those help numbers, talking to each other about problem gambling, asking for help. And then the system impact is going to be stronger collaboration across the regions and expanding that availability of treatment and recovery. So making sure that our support meetings include problem gambling. So Gamblers Anonymous, Smart Recovery, all of those things link back to problem gambling. And longer term impact is really about building a system that responds consistently. So again, we want to reduce that gambling related harm. We want to intervene early before it becomes a major problem. We want our recovery networks to be strong, and we want this to be across the whole state and operating on both all the way across the continuum of care. So prevention, treatment, and recovery. And the way that we're going to keep this going, because this is new. These are all new projects. It's a new program, and so we have a lot of growth opportunities. So what we're going to be looking for in the future, community mental health centers, health departments, community-based organizations, those are all places that we're going to be looking for partnership to build on this work. And so the way you'll find out if your organization is interested in some of this stuff, we are going to post to our website. So there's a QR code there. There's also a little URL. And then at the end, I have a place where you can sign up for the email list. So we'll also send out if there's training opportunities that I see that someone might be interested in. And then also, of course, our funding announcements will be sent out that way. And that's at the end. So if you want to sign up for that, you can. And this is just some of the resources that are already available. So we have the National Problem Gambling Helpline, Gamblers Anonymous, the Kentucky Council's up here. The 988 Suicide and Crisis Lifeline is always a good resource to give out to people. And then, of course, our own website. And then the last thing, I just want to go through the resource kit really quickly. You have a physical copy, but you can also access a digital copy here, and that's free to use. You can print it and give it out to people. You can send out the link, whatever you need it for. You can take individual pages. You can give out the whole thing, just whatever meets the needs of you and the people that you're serving, or friends and family, people that you know. And just kind of give you a quick overview of the pages. We have one that kind of gives the basic definitions. What we're intending with this is really giving an overview, and everyone may think of something different when they hear the word gambling. And so what we're trying to do with this is really provide a definition when you begin that conversation, because seeing on this list like bingo, not everyone may recognize bingo as a type of gambling. We may more frequently recognize that lottery, sports betting, card games, casino games, those are more obvious, but we want to make sure that we're highlighting that any activity where you risk something of value in an attempt to get something else of value, of greater value, is considered gambling. We have a few tips to keep gambling fun. Again, these are just as you're beginning to gamble, you're really checking in with yourself to make sure that, I don't know if you can really even see those, but they're in your little packet, just to make sure that you are able to engage with it in a safe way. And so this can really help to facilitate some of those conversations. We have one page on common thinking flaws. So these are errors in thinking that everyone has, right? Regardless of, it doesn't mean you have a problem because you've had one of these thoughts. I think the most common example would be magical thinking. If I wear my lucky t-shirt, UK is going to win. If I wear my socks, my presentation's going to go well. So these are just kind of things that humans do, but in doing them, you can set yourself up for riskier gambling behavior. So it's not about stopping those thoughts, it's just about recognizing that they are kind of flaws in thinking and making sure that you're stopping to think before you continue to gamble. We have a little bit of information on youth gaming and gambling. So some of the activities that youth may be involved in gaming that can mimic gambling behavior. So even if they're not using real money, login rewards, spin to win mechanics, those kinds of things can start to develop habits around that mimic gambling and also normalize the behavior, which could put them at risk for developing gambling problems in the future. Which again is not to say that they can't play games, they can't do these things, but it's just something to be aware of as children are using phones and apps and games, is really thinking through what is the game asking my child to do and what are the conversations we need to have around those games and apps. And then we have 2 pages just about identifying problem gambling. So one kind of just goes through the warning signs, and the other one does include a little screener. And we do highlight here that just because you answer yes to these questions doesn't mean you have a problem. It just means you may be at risk and should maybe start thinking about reaching out. So we're hitting that early intervention, making sure people are being mindful about their behavior. And that's all I have for you. So this is how you can stay in touch with me. That is the email address for the program. And then if you want to join the mailing list, we have the Problem Gambling Assistance Program contact list. So that's where you can receive updates about opportunities related to the Problem Gambling Program. So training, resources, notices of funding. And I also included the Mental Health Promotion newsletter. You can sign up for either or both of them at this link. And that's just a monthly newsletter that I put out that has tips for staying mentally well. Sometimes I slip problem gambling stuff in there. I try to make it really focused on what's relevant month to month. So March, we have March Madness. So this month's had a little bit more on the problem gambling side because it's Problem Gambling Awareness Month, it's March Madness. So I really wanted to bring that to the forefront. Like May is Mental Health Awareness Month, so there'll be a lot of just basic mental health. April is Stress Awareness Month, so there's some stress management tips. And so both of those things are just kind of designed to help you stay in touch and help you stay well. And if there's any questions, I can answer those. Go ahead.
Number one, your lucky t-shirt's working. Yes. Kentucky's ahead 10-8.
Yes. Thank you. I appreciate the update.
But it's early.
It's early. There's time to mess up.
So, but what you mentioned about the workforce development, and I know we kind of emphasize from the treatment standpoint how important it is to get more and more men and women counselors certified. And I know Ronslyn's been very active in trying to increase the number in the state. You mentioned also training of other persons like case managers and peer support. Is there any way you're going to measure whether that is effective in what outcome measures are you looking at? Just the fact that you trained them, or the fact that what's the impact of training those people?
I think it'll depend.
How's it going to affect more addressing problem gambling?
Yeah, let me just repeat the question for the people at home. The question is how, when we're training people other than counselors, like case managers, peer support specialists, those support staff, how are we going to measure effectiveness? And I think that'll depend on the profession itself, what tracking mechanisms already exist. Like I know with case management, they already have a lot of training that they go through, so just putting this in there. And as far as tracking the impact, it'll be similar to what we're doing with other the other resources. Is, are you making referrals, and are those referrals being followed up on? So that's usually a simple survey of case managers who have gone through the trainings and following them a year or two out, you know, how have you used this, and then having them track any referrals that they give. So we can get data like that from any trainings that we do. Go ahead.
Do I need the mic? Okay.
I'll just repeat.
Okay. So if I can talk a little bit about the Project Ricochet Workforce Development Program, and to answer that question, at least from our angle, and the impact that we hope to make is that we are training 25, at least 25 community-based professionals who are either barbers, stylists, doulas, or actually are CHWs within the Project Ricochet ecosystem. In the process of that, so that it's very metrically based, so we have a defined line of exactly how many and in which territories that they are in within Central Kentucky. But additionally, as they provide services as well as referrals and follow-ups, they have to complete an outreach report, which we can now follow and track longitudinally the impact that we're making across the state, or at least in Central Kentucky.
Exactly, and thank you, that's the exact model that we like, and we would use in other trainings that we do.
Another question. I know most of this money that's coming into your department is new, since the sports betting is kicked off a couple of years ago. Are you all having to report to the legislature what you're doing with this money? And
Yes.
is there I've always got concern, if the money is not being spent, they'll find a way to find other avenues to spend that money. They don't like to see money sitting in an account
Correct.
not spent. So do you have plans for use of that money? I know we're not going for treatment until we get the workforce development, but it concerns me that there's money there that doesn't get allocated, and the legislature will then say, well, we'll find a place to put it, and not in gambling.
Yeah, so that's a good question. We do report to the we file a report with the Legislative Review Committee annually. I think those are due in October. So every October we file a report on the previous fiscal year. And in the regulation right now, those funds roll over. So if we don't spend them, we can spend them again next year. But our goal is to spend as much of that funding as we can on these projects. And so of our, I don't have the numbers exactly, but I do monitor that of how much is coming in and how much is going out. And so when we do a new release of funding opportunity, hopefully this fall, that will factor into the applications that we approve. So if we have so much money to spend, that's how many projects that we can approve. So maybe if we get 10 applications, depending on what those applications are for, if that's all of our money, then we can fund all 10 of them. If we have to pick 8, then we'll pick 8 of them. So, the notices of funding opportunity are the mechanism for making sure that we get the money spent.
I think the concern would be the legislature doesn't like to see you holding on to money, because they want that money
Yeah.
out there in the community doing good.
Yep.
And if they see it's just sitting there for 2-3 years, and
Yeah.
why is it not being spent, then they're going to.
Yeah,
Concerned about that.
and we have a lot of projects going on right now. So, I don't think that's too much of a concern. I think that's it.